Gustavo, can you hear me well? Give me a thumbs up.
Yep.
Yep.
Good to go.
We're gonna go ahead and get started. Welcome everybody to this webinar in English about maternity and dairy newborn calf management. My name is Dr. Juan Pinero. I'm an assistant professor and extension dairy specialist in the Department of Animal Science for Texas A&M University. And before we get it started, some housekeeping rules. Please, if you have any questions, type them on the Q&A box, and we will go through those questions at the end of the presentation. Now, it is my pleasure to introduce Dr. Gustavo Schunemann, full professor at The Ohio State University. Gustavo obtained his DVM in Argentina in 1988. Then he obtained his master's and PhD at the University of Tennessee in 2004 and 2008, respectively. He's a internationally renowned faculty. And with that, Gustavo, the floor is yours, and I'll let you go ahead and start.
Thank you. Thank you very much, Juan, and thanks everyone for connecting. So I'm going to go ahead and do a practical presentation on managing the maternity. And the most important is the processes associated in the maternity, and with the goal, of avoiding, excessive calf mortality, at the maternity. So, when looking at in general the maternity, we process, the cows, the newly, cows and calf. And so there is a significant impact on the maternity that comes, some of the variation that we see, whether it's associated with colostrum volume or associated with a stillbirth, right? It's a number of things that are coming from the close-up, from the dry period, especially the last 60 days of gestation, right? So I will really emphasize that area because I think it has a profound effect on how we manage, the maternity. And then I'll share a little bit about the maternity itself, things that I think are the most important, right? And whether we should, there are different ways of doing indoor housing, outdoor housing, right, for the maternity. And but in general, I will try to, share common things, right? And where we collect the, colostrum, where we harvest, the colostrum. Do we do it at the maternity, right? Do we do it at the parlor? Every farm, there is not a one size fits all. You can accomplish the same task in different ways, but definitely there are specific things that you have to pay attention, right? And one of those important is animal handling and hygiene, right? Those are absolutely priority, for both, for the cows and the calf. And then the cow will go to the fresh pen and initiate lactation, and the baby calf will go through the replacement program. So I just share, a few things that most of us are familiar with the, housing system, especially for the indoor, right? And so we will go through some of these detail now, but because we do now a number, I would say probably half or maybe more now, of the U.S. dairy cows are bred with beef bulls, right? So these what we call beef on dairy, right? So it is important to know here are the average gestation length, right? And the reason why I say this is because they will, in one way or the other, may impact the maternity, right? Especially when it comes to, too large of the calf, right, for the cow, right? The bull has substantial effect on gestation length, right? And the dam, the cow, has a more weight on birth weight, but gestation length and birth weight are directly associated. So it is important we know most of the, dairy cows do have about 280, right? And there might be some a little bit more longer that are more, the double purpose, cows. And but when it comes to the beef bull, especially those, it has a little longer gestation. So it's important for us to keep in mind when we do the mating system that they are, within range. And the good news about it is it has been working really well, right? It has been working really well, and we were able to find gestation lengths that are similar between the breed, and it works, quite well there. Right. So when you look at in general at the US, 9.3 million dairy cows. So we got about on average, right? And about 38 33-34% of calf morbidity. That means from birth to weaning, about 60 days, maybe a little longer, right? And about 5% is stillbirth. That is, those are the calf from normal gestation length, right? Those are either born dead or die within 24 hours, right? And there is a number of factors that affect this, right? There are factors associated with morbidity, and there are factors that are associated with mortality. And we will go through some of these, because what I'm gonna do now, right? So I'm gonna share with you all what the best farms are doing, right? What the best, because when I look at the best top 10% of the farms in the US, right, they are already achieving very, outstanding performance. This is failure of passive transfer, colostrum management, right? And but also in calf mortality, because now we have a number of farms that has 1%, right? No 1% is stillbirth. So I'm going to share with you a little bit what I, come across and working with these facilities, what they are doing to accomplish this, right? So it is important, we see that 1%, the phenotype, right? We go to a farm, we see the phenotype, they are accomplished, very few calf losses there, right? But when you look at the genetic, has been a major improvement, right? We've been emphasizing more and more, and this will get even better, right? Beef cows are selecting for different traits, dairy cows were selecting for other traits, right? But now more of this longevity, survival, right? They are all coming into place, and we've seen that on the farm. So the genetic improvements, has been, now we see the phenotype on the farm. So when I look at the cows, Holstein cows, for example, right? Yeah, we do have, from the genetic point of view, you can achieve less than 2% stillbirth. This is, quite well, and it will get better, right? And we see that on farm. Right. So one of the questions that I get, often is it possible to get, less than 2%? The short answer is yeah, absolutely. You could get that one, right? And we will go in a minute now how we do this, right? So when I look at the best, 10% in terms of, stillbirth, they're already there. Right, they are already there in 1.3%. And here is an example. And in this example, remarkable, because not only we do achieve that, with Holstein cows, right, with dairy cow, but also with the beef on dairy program. So in this particular, data set here, it's a quite large dairy farm, but they are breeding, these are crosses, Jersey Holstein cows, and crosses, and they are breeding with limousine bulls, or with beef bulls, and yet, despite this, we were able to find bulls that are matching the gestation length of the cows, right? And yet we get, 1.3, stillbirth. So this is, just to show that, yeah, we can achieve that one. And there is a number of things that we need to do prior to calving, at the maternity, right? And right after the maternity to make sure we accomplish those, those goals. One of the most important things, perhaps, for the cow life, right? And I think about it, that the calf, think about the calf is like, it's like a fruit, right? When it mature, the calf inside the uterus is what trigger labor. So the calf is actually the one triggering, not the cow. The calf is the one, when it mature, it trigger labor. So it releases cortisol, and the cortisol release all the cascade of events associated with, with labor. So one of the issues that I'm working now is I see, mycotoxin is worldwide an issue, right? And then about 25% of the diet could be contaminated with mycotoxin. And in most of my cases are contaminated with 4 or 5 mycotoxin, right? So I'm looking at more closely this before, calving, because this is one of the critical points that affect the maternity, right? And it will affect in 2 things. One is colostrum volume, right? It will drop quite a bit. And the other one is you see too many cows with short gestations, right? Why is that? Because a number of these mycotoxins are pro-inflammatory. That means that it can increase cortisol, and that trigger labor, right? And when we trigger late one, we have short gestation. That is what we have most of the problem, most of the calf mortality issues and most of the early lactation problem, especially ketosis and DH, right? So this is something that we definitely keep an eye on, and this is what we call, too elevated. These are too many cows. These are cows that were in the close-up pen, prior to calving, less than 14 days. It's about 24% of the cows. So it's extremely high, right? And some are very seasonal, right? And the summer, you could expect that the summer go up. The summer are also pro-inflammatory, right? And also twin pregnancy. Twin pregnancy also has short gestation, about 7-10 days shorter, right? So that is another thing important. We do have farms where they fall within what we expect for short gestation. This is another example, right? And this example is only 8%, not 24%, right? And most of that is during the summer, right? So this particular farm, for example, each farm has their unique environment, right? And sometimes I understand that environment, and individual people has the capacity to overcome limitation, right? And but the best facilities that we have, cannot overcome poor management. So management is absolutely important in these places. So there is a lot of variation here, but most of the variation in this particular case, the cows are within expected normal range for gestation. Like I'm going to share now what is normal, short, average, and long gestation, right? But this is more the summer effect. So the facilities are not well prepared to mitigate the heat stress. So then we increase in the summer a little bit the short gestations, right? And cow. And that will definitely have an impact. This is nothing to do with the individual working in the maternity, but it's more the environment, the impact of the environment on the cows. So because of this, what I just shared with you, we did a study. One of my PhD students, Dr. Bernardo Menichetti, we did a study just to test this, the interaction between the anionic diet, right? Because in a number of farms, we do use anionic diet to prevent hypocalcemia, right? With our vaccination program. That is another one, because what we notice is, on average, gestation length is about 280 days, 279, and that is for most farms that use Dairycom, depending on the record system. That's how we move cows from, lactation to dry cows, and then from dry to close-up, and that is how they are being moved, right? But not all cows follow the books, right? And so when you look at the data, what is normal is you're going to have this gestation length in Holstein cows. It has a range, right? And that range goes from 255 to 297, right? 296, right? So that is the normal gestation. And it's seen outside when I do, the assessment in the maternity, and I'm looking at a stillbirth, I only got those animals that are coming from the normal gestation length, right? And this is the normal range from 255 to 297, right? So, but what is the average? So what we should expect is about 9%, 12% should be short gestation. About 82% of the cows are going to be average, right? And about 6 to 9% are going to be, long gestation cows, right? This is important. So what happened in this study is that, many farms vaccinate with two things. One is to prevent mastitis, right? And the other one is to prevent diarrhea in calf, right? So you vaccinate that one. Most of the vaccine is done 60 days prior to calving, right? For those individuals that are using 60-day dry period, right? They do the vaccine, and they do a booster vaccine, right? Right before when they move to the prepartum pen. But what we notice is that there is the problem when you do 21 days. So here is 21 days, which is 255, or 249 days, which is 28. So we were testing this. All cows got a vaccine at dry off, right? And then all cow has a vaccine either 21 days prior to calving or 28 days prior to calving. Why we did that one? Because what happened in reality is when you do a booster vaccination, right, to the cow, that causes an inflammation, that triggers an inflammatory process, right? And the inflammatory process, that process inside the cow, the physiological process, interact with the parathyroid gland. The parathyroid gland is here in the cow, right? And in general, half of the cows are going to be more than 20 days. If we're using 21 as an example, that's going to be at least 20 days. But the problem is with the short gestation cows. So you might be vaccinating cows that are within these 21 days, right? And that we should not vaccinate cows there because that activates the immune system, and many cows go in the negative energy balance, right? And so the problem was the short gestation. So what we were testing here is if we vaccinate a week earlier, or we including moving the cow a week earlier to the close-up pen, compared to the 21 days. So what happened there is this. It was remarkable because the number of the study now, shows that 28 days better than 21. But the physiological reason is the interaction between the anionic diet and the vaccine. So what happened is that the vaccine caused an inflammation, and that inflammation inhibits the parathyroid gland, the same one receptor that the anionic diet is trying to stimulate to upregulate calcium in the cow, right? So what we found is a significant reduction when we vaccinated a week earlier on day 28, right? A significant reduction on subclinical hypocalcemia, right? By 46% is a massive event, right? More glucose at Calving. And think about this. If the cow has the antibodies in the blood in circulation, that has zero effect for what we are trying to accomplish. You want the antibody to be inside the mammary gland. And to go from the blood inside the mammary tissue is an active process that requires huge quantity of calcium and huge quantity of energy, right? So what we notice also, when we vaccinate on day 28 compared to 21, our IgG concentration in calcium went up substantially, 20%, right? And that is what we want, right, to prevent, especially diarrhea, right, early on in the first week of life in calf. So this is an important concept, especially, to prepare your prepartum cows, right? So the other one that we really work, and I see that these farmers accomplish 1%, is they do have a system to monitor these processes, right? So sometimes they are very simple processes. They use like a time-lapse cameras, right? And what they are doing here is just monitoring the feedback, right? And they look at the feedback. For example, in this case, this is August 2021, feeding once a day for this particular case, right? And you can see by looking at the feedback that in the video, this time lapse is not showing anything, but there was a number of hours, depending on the day, that there was like 4 or 6 hours a day, the feedback was empty, right? No feed. So that is really bad for the cow, especially for prepartum cows, right? You don't want to have that one. So sometimes what we do is we use the Google Share Drive. We go there, set up the camera, right? And I set up for an entire week, right? And it takes one picture every 10 minutes, right? And it gives you a video of about 10 minutes for the entire week. And that is very representative of how we manage, the feedback. And then I show that through, this share drive in the Google. Basically, we upload the graph and we upload the video, and people know how to do it. So I see what you mean. And they do check, and they get very consistent, right? Very consistent. This is a month later, right? A month later, just to look at that one, and it has a profound effect. What we know that has an effect is in colostrum volume, right? The cows are not losing body weight, and the most important are your heifers. Heifers are very sensitive to lose body weight prior to calving, and that will trigger your, especially calf mortality at calving, and a lot of work, especially for the maternity crew, right? You reduce cow losing body weight, and then you improve all these, basically dropping ketosis and DAs, because these metabolic challenges are directly associated with cow comfort. Cow comfort, one of the concepts of cow comfort is the 5 freedom of animal welfare: access to water, access to feed, thermoneutral, be able to express normal behavior, which is eating, walking, and resting, right? And don't be afraid of people and free of pain, right? So this is an important component. And then coming to individuals working on the farm, right? And recognizing what are the imminent signs of, birth. And this is something important. This is common sense. Most people are used to work on farms. They know for some of the newer ones probably don't, and how to recognize these cows, right? And the reason why it's important, because we still, move cows depending on the housing system, right? And if they are indoor, right, like the close-up indoor barns and the maternity, we move what we call just in time. So as soon as we see the water bag, right, or the amniotic sac, we move that cow to a maternity. And that is important. I'm going to highlight why is that important, the process, right? And it is also important that, you know, we should not move too many times a cow during the transition, right? We try to minimize that exposure, because the more we move a cow, the more the problem is for the cow, right? But that, you know, recognizing the imminent sign of birth is important, because then the cow will only be for labor, you know, in what we call the maternity box, right? Especially for indoor housing, right? Another component important is that, you know, the calf presentation, right? Either forward or backward, they are normal, right? But most of the time, people will deal with this one, but they need to recognize that one, right? Because what I noticed after 15 years or 20 years doing Calving training is that the individual, most 80% of the dead calf, you know, you're going to have about 8% or 8% of this backward presentation, right? But the issue is, if individuals do not recognize whether they are coming forward or backward, they will lose quite a bit of the backward. They are normal both. The more frequent is the forward position or presentation, right? But this is important to recognize, because you might lose because they are with the head down, right? As soon as the umbilical cord collapses, they have no more oxygen and they will start breathing head down, right? So, but recognizing the detail makes the difference at the end of the day, right? For most of the maternity, you know, managing. So sometimes it's just recognizing what is normal for them, right? And for individuals never work on a farm, they probably struggle with this. You know, they see something coming out of the cow, but they don't know what it is. And then we teach that one, right? We teach this one to recognize individuals, or the position of the hoof, and how is the position of the hoof, whether the hoof are coming like this or coming the other way around. That will determine whether they are coming backward or forward, right? This is just, it's a big calf, right? And they just barely fit in the birth canal, but they are coming forward, right? Because the position of the hoof, this is where the calf, you know, will stand on, right? This is the you know, the calf are coming like this. So if we'll come the other way around like this, then you will say these are the real legs of the calf, right? That is an important concept, because that will determine how long they should wait there, right? So I'm going to present now the 3 cows that I see on any farm, right? Regardless whether this is indoor or outdoor, right? But you're going to see 3 cows. You're going to see the normal cow, right? I did an experiment, just a visual observation study, just to assess this one, right? These are the normal parturition process, right? So here you have the time is right here, and then you have the frequency of abdominal contraction. This is things that we see from the outside. We don't see the uterine contractions, right? And the duration. So every time that the cow do a contraction, for how long the cow, you know, hold the contraction. So usually most cows will lay down, right? And about, you know, 15, 20 minutes or 10 minutes later, we'll have the amniotic sac, right? And it's very clearly every 15 minutes, you know, there is calving progress. So the cow will work in labor, right? And that is what I teach people. So don't disrupt the cow. Just let the cow work. This is a normal process. So abnormal is when you had to do something with the cow, pulling the cow, right? Just let the cow work, right? Work through the labor, right? So these cows require a lot of energy. So you don't want your cow to be losing weight prior to calving, because the cow will not go through a normal calving process, right? But the cow in general will do 114 abdominal contraction in 14 minutes. At the very end, the cow will do 2 big, you know, contractions, especially abdominal contractions, right? And the calf is out, right? The calf is born, right? It's on the ground, right? So now when it comes to the heifers, it's a little different, right? The heifers is completely different. I think that happened also in humans, right? And so they don't know what's going on. They never experienced this before. So what I noticed when I did this observation study, they, you know, lay down, stand up, lay down, stand up. They start pushing too early, right? They start pushing because they are scared. They don't know what's going on. So, but once they get the amniotic sac out, you know, right? When you see that amniotic sac, that is when it's time 0, right? Usually we start counting when you see the amniotic sac. This is why it's so important, the frequency of observation in the prepartum pen, right? At least every 30 minutes, you have to walk through to be able to see it, right? They will go through these, 15, 20-minute Calving progress, right? But now heifers, even though they have a smaller calf, they do a lot more force, right, to get the calf out, right? So these will do on average 160, abdominal contraction. This is a lot more work, right, for a smaller calf, right? So that is important because the people I teach that one, they should not let the cow in labor more than 2 hours. They are exhausted. So they stop pushing and they just cannot work anymore, right? So, and then teaching all these, this is Calving progress, right? You see the amniotic sac, the cow go through these, showing feet and the nose. You can see here, this is a forward presentation because you see the nose. And then the calf, is born. Usually the cow stand up and start sniffing and licking the cow. That is the normal process. And most people see that and recognize when they get this one, they know exactly what to do and when there is a problem, right? So I'm going to share now when individuals do the intervention. I think this is when you get really, people need to know exactly what they are doing, right? We know there is a number of studies, I don't know how many, maybe over 100, right? That anionic diet is very good to manage the risk of hypocalcemia, right? But if we don't have the maternity individual knowing what they are doing, what they have, especially when they are, they're impatient, so they go earlier to pull. There is a very fine line, right? If you pull the calf too early, right, then you save the calf, but you might damage the birth canal, right? And especially laceration in the birth canal. So this is the issue with that is that cause pain, right? Sometimes normal is just waiting 15 minutes or 20 minutes more, right? But if they go too early, so that damages the birth canal, so pain is negative with dry matter intake later, right? The cow is under the endorphin. It's a natural controlling of pain, especially during the first 24-hour around parturition, right? But right after day 2, day 3, so if there is laceration, that has caused pain, and then dry matter intake goes down, and then you have the metabolic problems and the metritis that you might think is because the anionic diet is not working, but actually it's the maternity what is causing some of these issues with dry matter intake consistency, right? So the number 3 cow is my dystoxic birth. These are the ones that you will have to do some intervention, right? But the cows here has a complete different profile, right? The cow has, it spent a lot of energy. They do these 270 abdominal contraction an hour, lay down, stand up, lay down, stand up, right? A number of these. And the cow reach a point after an hour and a half in labor that she can no longer have any more energy to push, right? Think about this. A normal cow will do 114 contraction, a normal heifer 160, and a dystoxic birth could go up to 270. So it's almost 3 times the effort. So that is why I always tell people, don't let your cow stay longer than 2 hours since you are seeing, the abdominal contraction or the amniotic sac. And heifers, they start earlier with some of these labor, especially abdominal contraction, earlier than the amniotic sac. Right? So, and here is the time. Sometimes you see Calving progress and all of a sudden stop. And they stop, so they don't need no more progress. And you had to do the intervention, right, to say, just to pull the calf out of the cow, right? So that leads me to this question. How long should you wait before intervention? Assuming there is normal presentation, there is no issue with the cow. So the right answer to this question, I generate discussion with people, just posing this question, just to see what they do. I say, in general, you're going to go about an hour, right? If you want to make, an error, maybe go earlier, but not later, right? And don't let the cow more than 2 hours in labor because it's too much of labor work and they almost always are exhausted. They don't have any more, energy to keep pushing the calf out of the uterus, right? So another important question that I work with individuals is how hard to pull, right? When you do these interventions on the farm, right? So usually, I tell, no more than the force of 1 or 2 people, right? This is what we should expect there, right? And I explain the anatomy, and this is the same in humans or in any mammal, right? So this is the pelvic, right? And the calf will go through the pelvic, right? And on each side come this, what we call the sciatic nerve, right? So if they are pulling too hard, right, and too much force, this is why I don't like this one, right? If individual use some of this one, you have to be absolutely careful, because you do a lot more force, almost 5 times more than 2 people, right? And you very likely damage the sciatic nerve, and what happens is the cow will stay like this. So, and this is, we know that sometimes it's, things can happen because the calf is too big, but I try to avoid this situation because this is really bad for both, for the calf and for the cow, right? So no more than 1 or 2 people when pulling the calf, right? I'm working now on maternity, especially those that are getting 1% stillbirth, right, to get it to the next level, right? And what I noticed is that I want to have a thermoneutral maternity, so it offers thermoneutral, at least thermoneutral, maybe a little higher for baby calf, right? And it has to be clean and dry, right, environment. And I have done in this outdoor maternity major changes, especially with bacterial load, by switching. Some cows have this dry lot, right? And it's not an issue. They go there, but sometimes the cow will release a lot of water, right? A lot of this amniotic fluid, right? And the calf start getting exposed to this bacterial load, right? And what we do, very simple in some of these farms, is we prepare either a corner or a pen or something that the calf, will drop into this straw bedding, right? This is a lot cleaner. And what I noticed when I started working on this, that our diarrhea, especially the first week diarrhea, significantly drop, right? Significantly drop because the exposure, to bacterial load. So very simple things that can be done at the farm that has a profound effect, especially when it comes to calf survival, right? So the next question is, what is the expected colostrum volume? I get a lot of questions about colostrum volume, right? And especially, I'm just 2 major breeds. Most of our cows are Holsteins, but we do have Jersey and maybe some other breed. So here are just the value, expected volume, especially for the first milk, right? And about 4 kilos, right, for heifers, or 8 pounds, right? And multiple cow will have way more, right? But there is variation. It goes from 0 to 20 pounds. So depending on each one of the cow, and also there is seasonal variation, right? Heifers, Jerseys, it's a lot less, right, in volume, and heifers and cows are about the same. Maybe cow has a little bit more, but also a similar variation, like Holstein. There are seasons where we are short of colostrum, there are seasons that we are really high. There is a photo period of effect in cow, especially in the fall, and when the first frost, water intake goes down, and water intake will affect colostrum volume, right? That definitely will have an impact. The other one that I see is mycotoxins, right? Mycotoxin has a profound effect in this colostrum volume. And the other one is what we call the aversive handler, right? If the maternity, they don't know how to, they have to be absolutely calm, when managing the maternity, because anything that stresses the cow more than labor, right? And it affects the milk letdown process. So cows do not release the oxytocin. Colostrum is there in the udder, but they cannot get it out, right? So that is a different story, right? Colostrum volume could be because you cannot get it out, or the cows do not have enough in the udder, right? So, and this is important also, birth weight, because now when we do this protocol on the farm, we look at birth weight, because I just want to know how much, because we are feeding colostrum now based on a percentage of body weight, right? So, and there are major different. Let's say 40 or 80 pounds for Holstein cows, and a Jersey calf might be 60 pounds, right? Or 60 pounds, so it's a lot less. So the volume that we use for these 2 different, breeds are completely different. So when writing out the protocol, that really matters. And I'm going to just give you now those numbers. I really like this one because what is the appropriate timing for colostrum harvesting, right? And usually we are within the first, 2 hours, the first 3 hours, right? The first 2 hours, I would say that most farms that I work, they do collect right away after calving. They let the cow interact a little bit with the calf, right, for an hour, and then they collect the colostrum, right? This is very important, especially for heifers. You have to be absolutely calm, where the cow has to be a quiet area, right? And people have to be calm around the cow, right? And if you do not get enough volume of colostrum in the first milking, I always by default tell people wait 4 more hours, right? And almost always that works. So just waiting 4 more hours, usually that works, and they do get the colostrum, right? Sometimes pushing too much or trying to process or multitasking creates some of these issues that they don't get the volume, right? The right volume of the colostrum. So they just wait a little bit longer, and you will get the colostrum volume. What we do know is this, what we call the Versi handler, right? A little bit more aggressive, a little bit more, electric prod, twist tail, that should not allow on the farm. That should not be allowed on the farm, right? Because cows can recognize one individual, right? We know that, animals recognize aversive handler, right? And that has a profound effect in milk letdown. Right? You need about 1 to 2 minutes or 1.5 minutes, for the release of oxytocin. Without oxytocin, right, you won't get things like this. This is, for example, what we wanted, right? This is just right before we go and prep the cow to collect colostrum, right? So, and think about this, a versing handler can reduce almost half of the colostrum volume. You do get the colostrum, but you don't get it because the cow will hide the milk. Think about this. The cow, about right next to the teeth, we have about 20% of the colostrum, right? 80% of the colostrum is higher up in the tissue, and you need the oxytocin for the cow to release the colostrum, right? So I make a lot of emphasis when I work in a maternity that people understand some of the physiological process, because they really work very well when they understand, why and how things work, for the cow. Right. So once the calf is on the ground, right, and definitely you have to process the calf, right, and every farm, most of farms do about the same. Some farms do more of the detail, but in general, a number of farms will do body weight, right, because that is a metric that we use for our replacement program, right. So I know my average mature cow weight, and I know also my birth weight. Now I have a metric that I'm going to monitor during the replacement program, especially to estimate, average daily gain in animals. ID animals, right? And remember that we may have, 100% dairy, sex semen, right? Beef on dairy, twin pregnancies, male and female, especially you had to mark each one of them, right? And I work with individuals, and I really like it because sometimes I go to farm and they have really nice system, right? Very visual for individuals to recognize. I know which one it goes with each one of the tags that we need to get on the farm. They process the colostrum, they disinfect the umbilical cord, right? The umbilical cord, and they do 3 times, right? They do right away at calving, 2 or 3 hours later, and 2 or 3 hours later, right? And they keep the calf in the maternity for at least 24 hours, right? The ear notch, especially those that are, testing for DBV, and then they move the cow, the calf to the individual housing or the housing that they have for the replacement heifers, right? So when it comes to feeding the colostrum, right? Feeding the colostrum to newborn cow is critical for both, health, right, and survival, right? Quality is important, right? And I really want to emphasize, right, for many years, we've been using like these 50 grams by liters or 50 milligrams by ml, right? But the new studies, they are now more than like 70 grams by liter, or by kilo. So this is important. We know that feeding more IgG has an impact, a positive impact for the cow, right? Quantity is usually, most of these farms that are about 1% stillbirth, they are feeding about 12% body weight. So they know their birth weight in the calf, and they are feeding about 12%, right? As an example, if they are 40 kilos or 80 pounds, 85 pound, calf, they will feed about a gallon, a little bit more than a gallon, right? On two feeding. So they don't do in one feed. And they do the timing in this way, right? 8% of the body weight will go the first feeding, right? And about 4% in the second feed, right? This is important because I noticed when they start doing this, we have a significant drop in both diarrhea and pneumonia, right? In both cases, right? And they definitely are outstanding in their cleaning and sanitation. I cannot emphasize how important it is because I always have a discussion at the farm. Sometimes individual working in the maternity, if you're going to collect your colostrum at the maternity, right, not at the parlor, at the maternity, those individuals need to be as good as your milking crew when it comes to hygiene. They had to have absolutely good protocols in prepping those cows, right? If not, it's better to get the cow up to the parlor, let the parlor individuals process the cow because they have a lot better process. They've been doing that for years and they know how to do it, right? This is important because, especially in the summer, sometimes, we have this outbreak of calf mortality, but it's just because septicemia. So colostrum is contaminated with bacteria, right? And another important concept to understand is that, the calf, definitely they are born almost with no immunity, so they need to get the colostrum from the cow. But the intestine is going to start closing down, right, about 4% an hour after birth. So in 12 hours, you lose 50% of the capacity to absorb, IgG. So it is important the timing and how much you are feeding to the cow, and also the concentration of IgG in colostrum, right? I really like this study. I really like it because I see this in the field. I have a number of farms that I work with that they do, they move from the traditional feeding program that was colostrum and milk, right? And they move to something what mimic nature or mimic the natural process in the cow, right? When I saw this study, I really, really like it because what they were feeding colostrum, but they also feed for the first 3 days, 50% milk, 50% colostrum, or even 25% colostrum. So what we call that mixed milk, right? I really like this because I seen positive things, better passage transfer, less morbidity, more average daily gain, so they perform better, right, and over time, right? I just want to mention that this is something important. I think when it comes, details matter, right, when it comes to performance, right? This is a study that I did just using an application. We were using an application to manage the maternity. There were farms with 800 cows to 10,000 cows, right? And we handed over a specific application to manage, timing to feed, from birth to feeding colostrum, right? And what you see there, I want most of, based on average. Here you have, these are individual people doing on the farm. Some people have very little variation. Some other individual has a huge variation, right? They could be feeding the calf right away, on average about 2 hours, but some of the calf might be 11 hours. So it really depends on individuals. So you have a farm here. So these are individuals working in the same farm, right? This is another farm, this is another farm, another farm, another farm, right? These are individuals. So we definitely don't want individual has too much variation, right? On average, they are okay. But what I don't want is individual too much variation. I want individual to be more consistent, right? More consistent. So now we know how to recognize, sometimes these individuals will either go through a retraining program or just reassign within the farm to some other areas where they probably excel or do, or do a better task, right? The maternity really require attention to details to work really, really well. And why is that? Why do we need detail? Because from the moment that the calf is born, you're going to be collecting colostrum, you're going to be measuring quality, a number of farm pasteurized colostrum, they all work, right? But at the end of the day, it depends on people, right? People make this process work, right? And some of them refrigerate colostrum, some of them freeze the colostrum, right? And I work with these because sometimes what they do is they freeze the colostrum in some of these containers. So, and it takes forever to thaw them out, and it affects the quality of the colostrum, right? So yes, it's good that they have that one, but it's better that if they are going to be freezing, they freeze in something that is very thin, right? Because when I place it in the water bath, it thaw out in a very few minutes. Otherwise, people are really tempted to increase the temperature to go faster, right? And yet it doesn't get thaw out evenly, right? And that it affects the feeding, not, but it affects the quality of things that we are, feeding to the calf, right? Hygiene, and hygiene, right? I really like it when I go to farm and I see something like this. They absolutely clean, right? And they have the tools to measure. We use these ATP swabs, right, to measure in an indirect way the bacterial load for the surface, right? And each shift is responsible to clean their unit before the next shift comes. So let's say that you had 2 shifts in a day, so they are cleaning twice a day, the maternity, right? And I'm using some of these reading for you. If you get more than 30 reading light unit, right, this is what the machine does, and you do the swab in the surface, right? Then they had to clean more. They had to clean, the surface really mattered, especially for calf survival and health, right? And then we do the pasteurizer, especially the valve. You can go there and just swab and see how the cleaning process in the machine is, or either the tubing line or the border, the nipples, right? We do swab, and we are looking for those just to get less than 5, reading light unit, right? And it really works really well. Once we get this process in place, they really, really work, right? And I want to emphasize something that I care about the people that work on the farm. And it's important, at Calving is when you have the shedding, a fecal shedding of salmonella or any other bacteria for that matter, right? So we are dealing with manure in most of these processes, right? So I avoid using the pressure washer. And there is a reason for that. I don't want the pressure washer on the farm. I try to say, don't use it. It's because the pressure washer, could, aerolize, form this very small droplet, right? Drop the water that has bacteria in it and stay in the air for too long, right? And that can people get it, right? So either people or animal, right? In case of salmonella, salmonella could cause enteric problem, diarrhea, but also could cause pneumonia, right? So this is important, especially for both, for people and for animals. So try not to use it. It's better the hose, right? Use the phone with sanitation and then the hose, but not the pressure washer, because it will stay in the air for too long, right? And there is a high risk that you will get some of these bacteria, especially individuals on the farm, right? This is my final slide. When it comes to, welfare of these animals, don't hit me, don't yell at me, don't punish me, treat me well. I'm the one who provides for your livelihood. So with that, I'll take any question you may have. Thank you.